Breaking news, as Chris just said tonight, is news that involves this network. Late tonight, within this last hour, NBC News reported both to our staff here in the building at our headquarters here at 30 Rock in New York City, and now publicly to everyone. NBC News has reported that an American cameraman who has been working as a freelancer for NBC News in Liberia, he has just tested positive for the Ebola virus. The cameraman had been working on the ground in Monrovia, in the capital of Liberia, with NBC News chief medical editor and correspondent Dr. Nancy Snyderman. Dr. Nancy, as I said, is going to be joining us live from Monrovia in just a moment. This cameraman was hired by NBC News this week. He was just hired on Tuesday, but he's an experienced journalist. He'd been working on the ground in Liberia for 3 years prior to that. Again, he is an American. He's reported to have come down with symptoms of Ebola yesterday, on Wednesday, at which point NBC News says he immediately quarantined himself and sought medical attention. Earlier this morning, he was given a blood test to test for the presence of the Ebola virus. Within less than 12 hours, that blood test came back positive. Now, NBC News is not disclosing the name of this freelance photojournalist at the request of his family. We know that he's 33 years old. He is an American. He had been working on the ground in Liberia for several years, most recently covering the Ebola outbreak in that country. But his diagnosis today makes him the 4th American known to have contracted Ebola who will be flown to the U.S. for treatment. Now, all of the others that we know of contracted it also while in Liberia. And like the 3 previous cases involving Americans, 2 doctors and an aid worker, this cameraman will now be brought back to the United States for treatment. NBC News President Deborah Turness has put out a statement tonight saying this: we are doing everything we can to get him the best care possible. He will be flown back to the United States for treatment at a medical center that is equipped to handle Ebola patients. As I mentioned, this freelance cameraman had been working on the ground in Liberia with our own Dr. Nancy Snyderman. NBC News is further reporting tonight that Dr. Nancy and the rest of her NBC crew in Liberia is also now going to be flown back to the United States, and they are also going to be placed under quarantine here in the United States for at least 21 days, which is described as the sort of conservative end of the spectrum in terms of isolating patients after potential exposure. We're told this is being done out of an abundance of caution. So far, none of the NBC staff, aside from this young American cameraman, have shown any of the symptoms that can be warning signs of exposure to the Ebola virus. But again, the breaking news at this hour is that a 33-year-old American freelance cameraman working on the ground for NBC News in Liberia has now tested positive for Ebola. That makes him the 4th American to test positive for Ebola up to this point. Joining us now from Monrovia is Dr. Nancy Snyderman. She's NBC's chief medical editor and correspondent. She's been covering the Ebola outbreak in that country. Her crew there includes this young freelance cameraman who's now tested positive. Dr. Nancy, thank you so much for being with us tonight. I'm sure this is a very, very difficult time.
Hi, Rachel. It's been a bumpy day, to say the least, but you got things right. This is a very experienced photojournalist who we hired to augment our team on the field in Monrovia. And yesterday, we were both at a border crossing, had our temperature taken, which is required by law now in most parts of Liberia when you're traveling from one area to another. His temperature was normal. My temperature was normal. As the day went on, he started to feel just tired, a little achy. And as you know, a lot of times when you're in the field, you work long days and don't take very good care of yourself. We just thought perhaps he needed some rest. He signed off early, went home, called me later that evening with an elevated temperature. At that point, I suggested and requested that he self-quarantine himself and monitor his temperature by the hour, which he did, and checked in with me. And this morning he went to the clinic run by Doctors Without Borders and was checked for malaria, which is very common here, and then also tested positive for Ebola, and he is being kept in the clinic there right now. The rest of my team, very healthy. We have been extraordinarily vigilant, but we are obviously very respectful of this virus, which has killed so many West Africans at this point.
In terms of exposure, we're told that the range of the time of exposure to when you start to show symptoms, when you start to show a fever, can be anywhere from 2 to 21 days. They're saying the typical reaction is more like 8 to 9 days. Do you have any inkling, or does this young man have any inkling of when his exposure or where his exposure might have been?
Well, we started working with him 3 days ago, so I believe his exposure was sometime, previous to that. We all carry thermometers on us. We all observe the custom now, which is to not shake hands, to not embrace people, to wash our hands with the diluted bleach water before we enter the hotel. We dip our feet in bleach solution. I was in an Ebola ward the other day and was in a typical hazmat suit that Americans are now accustomed to seeing aid workers in, and after that was meticulously disrobed by the nurses on the ground. We have really worked hard to minimize our risk. I mean, obviously, zero risk means never coming to Liberia. Minimal risk means crossing over into this country. But you are right that it is about 8 to 10 days from the time you're exposed to the time when you might show your first symptom, which is usually fever, followed by vomiting, achiness, and sometimes diarrhea. The deaths occur because the vomiting and diarrhea are so severe that patients basically don't have enough fluids, and then they run into clotting problems, and they die from that. The good news is this young man, our colleague, was admitted to the clinic very, very early. I spoke with him today. He's in good spirits. He's ready to get home, of course, appropriately concerned, but he will be airlifted out soon. And it's an abundance of caution. We are self-quarantining ourselves, even going beyond the CDC guidelines, because we recognize that there is a big story back home, and frankly, we want to be respectful to our colleagues and to the American public.
Dr. Nancy, I have to just ask you, in terms of that self-quarantine and these plans to bring that young man back to the United States for treatment, to bring your crew out, what do you expect in terms of your ability to continue to work, and what does this mean in terms of your day-to-day life and who you're able to have contact with and what that's going to be like now?
Well, because we know this is not a casually transmitted disease, and because none of the rest of my team has a fever, we have no other symptoms, we really present zero to marginal risk. I mean, I don't want to say zero because it's minimal. We really, you cannot catch Ebola from someone if that person isn't experiencing symptoms. And symptoms really include looking sick, feeling achy, and being exposed to bodily fluids, vomit, diarrhea, blood, urine, or sweat. We have mitigated those chances by being very careful. So our returning to the United States really presents very, very, very little chance of getting it to anyone. It would only be a risk if one of us ends up getting sick. So we will be taking our temperatures twice a day, checking in with each other, and if any one of us suddenly spikes a fever or gets symptoms, we will report ourselves to the authorities. We are taking it seriously, but I want people to know that we are well.
Dr. Nancy Snyderman, NBC's chief medical editor and correspondent, joining us live from Monrovia, the capital of Liberia, tonight. Take care, and please give our best wishes to your cameraman and your whole crew going through this, Dr. Nancy. We'll look forward to seeing you back safe and sound. Dr. Nancy joining us live tonight from Liberia. Again, the breaking news, though, tonight, that a young man, an American, 33 years old, who's working as a freelance cameraman for NBC News in Liberia, has been diagnosed positively with having the Ebola virus. That makes him the 4th American citizen known to have contracted the Ebola virus. 2 of the other 3 were doctors. 1 of the other 3 was an aid worker. All 3 of those Americans did contract the virus in Liberia, were flown home, and were successfully treated excuse me, and survived the disease here. This young man will now be flown back to the United States by NBC News. The Dr. Nancy Snyderman crew and Dr. Nancy herself will also be self-quarantining to make sure, out of an abundance of caution, that they are both safe and out of harm's way. We're going to be speaking with one of the nation's foremost experts on infectious diseases when we come back. Stay with us.